Subscribe now and press the bell icon. Never miss an update.
Welcome to all of you to this colloquium on responding to the nexus between adverse childhood experiences and drug use. Our staff here to felicitate and welcome Mukta ma'am. Anushka is now felicitating Mukta ma'am.
It's heartening to see young girls working into this field.
Himanshi kindly felicitate Marco sir. Aditi kindly felicitate Anju ma'am. And Samiksha kindly felicitate Gary sir. Thank you. We'll now request people on the dais to come and illuminate the lamps. Shweta sir as well. And of course not to leave out our Rajesh sir. Thank you all of you.
Thank you all for coming here. It's an intimate gathering, but the issue is not intimate. It's actually very widespread around the country, and I'm honoured for the guests who have arrived here today. We have our distinguished Justice Gupta, we have Anju from AIMS, and we have Marcos from the UNODC, and myself is Gary Reid, who is the technical advisor for SPYM, and also will be presenting as well. So I think really what we're trying to do here is to raise the profile of the issue of the vulnerability of what is occurring within the country of India, which will be presented by Anju. I will be giving an overview of the 3 centres that SPYM are operating for children. 3 centres, one is for boys involved in crime and drugs, and the other one is for boys involved in drugs. And then we have another centre in Delhi, Daryaganj, which is also for girls. And when we're talking about these age groups, we're talking children from maybe 6 to 17 years of age. And our exploration here will to be presenting some snapshot about adverse childhood experiences.
Let us look at the data from the General Population Survey first. This is based on the National Survey, the Magnitude of Substance Use Study 2019, which was the National Survey. The point to note here is, for a drug like, let's say, opioids, the use in adolescents is 1.8% as compared to 2.1%. It's pretty close. For a substance like inhalants, the prevalence is more than in adults, with more than 1% prevalence in adolescents. Cannabis about 1% as compared to 3% in adults. So substance using children in the country are opioid users, 40 lakh children, inhalant users, 26 lakh children estimated, and cannabis users 20 lakh children estimated.
So when it comes to living in a household where people can be humiliated, they can be insulted by their parents or by other family members, you can see here it's overwhelmingly that they have had this experience. It's not a happy home environment that these children are coming from. Then you start looking at issues about a little bit of physical violence occurring within the household towards the child. Have you had these experiences? Once again, overwhelmingly, 90% have had these experiences. But when you look at the girls, you can see over 50% have had some sexual misconduct. Now you can understand the issue of a sexual sort of interference, something is a bit uncomfortable. These girls have actually overwhelmingly experienced something.
Since all the years that university is doing epidemiological studies, this is the time of our existence that we have more prevalence, use, self-reported, etc. on use on children. Including from the age to 15 and 16, we're talking about 5% of reported of substance abuse. Another thing that I want to mention is, and I think this is also important, is the research, and I think the previous speakers alluded to this, is that the protective factors are the more important element to avoid any drug abuse disorder in the future.
We started to actually experiment and created a pilot. So our target audience, as you can see, is 6th, 7th, 8th is one level. The other is 9th, 10th and 11th. We have left out consciously the 12th standard children because they are into boards and all. We have training manuals for 2 levels, 6th to 8th, and the other is for 9th to 11th. And they have at the moment been developed in English and Hindi. And down the line, there is an effort to get it translated into regional languages once the SCRTs, that is the state level bodies, the education from the education ministry pick it up, and they will be held, they will be responsible for translating and then distributing to their teachers.
Initially, it starts as just Dr. Dhawan. I must congratulate your presentation was remarkable, and this is the kind of study we were looking for. We've in fact had number of programs for such studies and all that, but we never got any concrete data. At least today we have some concrete data with us. So see the consequences. Now if the parents were vigilant or if the teacher was vigilant, the life could have been saved. So these are small little things which we need to work out. Then as far as treatment is concerned, we are seriously lacking in the treatment. I was just speaking to Dr. Dhawan. AIMS initially had its center at Harinagar. Today at least we have no center in Delhi because it shifted to Ghaziabad. And mind you, we won't say that Ghaziabad doesn't need, but what we need is at least one such center in every district in the country.
The interconnectedness are far more, so Ministry of Health is an important partner which I feel, and we have somebody from here that also needs to come in because services are completely missing, and we know that there is urban health, district mental health program which is there, but we know the reality on the ground. So how do we strengthen that? Ministry of Women and Child is going to be a very important stakeholder in it, especially with Mission Vatsalya and a lot of restructuring happening in that. Child Protection Services, we have people from Child Protection Services. So we'll be happy to hear some of the views from these people as well and what they feel, if they can share their opinion of how confidence can be added into it there to strengthen this whole thing.
We have to look at the systems which are there and we have to look at how do we strengthen it. One of the things which we are working with Ministry of Health and Family Welfare is also to strengthen the school health and wellness program.
Sports culture, not only give some percentage marks to sports and and the PT teacher and you must come to her and get those marks. No, sports culture has to be there, and you have to make this prevention.
We have prepared a manual for the child welfare police officers and done one pilot training for them. But of course, like you said, mental health, suicide, many other issues, child abuse, substance use, many of them may be interlinked. Yeah. So all those issues may be interlinked. The other thing which you mentioned was what about school counselors? So I think that's a work Dr. Rajesh has been trying to do, advocacy efforts that schools should have counselors.
Maybe in 6 months we'll have 11 such centers working in different 11 hospitals of Delhi government, where 1 psychiatrist, 5 psychologists, 2 clinical psychologists will be there, and 3 applied or counseling psychologists will be there. So we'll have a chain of referral centers where the entire loop can be closed. Alongside, we have school health clinics also in place in these 20 schools, where a medical officer is in place, PHNO is there, public health nursing officer is placed, and a multitask worker to support them in their activities is also placed.
Like in our work also, I often come across the dilemma to ask about the stories of the trauma that the children have faced after a long time. Like today itself also one incident which has happened with the child in 2015, and now I have to take to the child to the court to narrate the story. So during you were conducting those interviews, did you come across anything like that? The children had a trauma again or had a breakdown? Or if it was, so what measures were taken?
Generally the questions that are being used internationally. So we were basically using an international format that has been used around the world. We weren't going to add anything. The only thing we added was about self-harm.
This is an inflection point in this subject of issue of substance abuse in the country. Maybe this is a small beginning, but I feel this is something happening here in this room, and it will probably impact the larger ecosystem.
I'll request Aditi to felicitate Shwetanji for beautifully moderating this session. I know a lot of you did not really express your opinion. Thank you so much, Shwetanji. And I'd like Aditi to welcome and felicitate Dr. Alok Agarwal, who will be moderating our next session post-lunch. Welcome to
Why are these children on the streets begging while our children are at schools? Children, especially those from underprivileged communities, are very...
So we're going to be breaking into 4 groups, and the topic areas are about the childcare institutions and the responses to adverse childhood experiences. That will be for group 1. We will work out who will fit in with which group, that they feel that their strength is the best. Group 2 is about the resources available for the prevention and responding to children who are experiencing adverse childhood experiences. Group 3 is about the legal structures, enablers or barriers to services to address these children who are having these adverse experiences. And group 4 is about the psychosocial challenges that are associated with adverse childhood experiences.
Exactly at 30 minutes we will stop. Okay. So we have to discuss what is the current status, I guess, of that particular theme that we are going to discuss. What are the challenges or gaps, and thirdly, how can we make it better? Is that
And basically it's a brainstorming.
Yes.
You just have to come up with, you discuss the issues, what do you think are the priorities?
So in psychological, we have included individual counseling, group counseling, family counseling, and legal cases. In legal cases, we provided counseling related to law, जिसमें कोर्ट से काउंसलर्स आते हैं जो बच्चों को काउंसलिंग प्रोवाइड करते हैं. द सेकेंड इज एजुकेशनल काउंसलिंग, जिसके अंदर एजुकेशन वाइज उन बच्चों का लेवल टेस्ट के अकॉर्डिंग हम ग्रुप्स को डिवाइड करते हैं, और वो ग्रुप्स होते हैं ग्रुप ए, ग्रुप बी एंड सी, विच इज लिटरेट, सेमी लिटरेट एंड इलिटरेट. एंड द थर्ड इज drug test. We are providing some assessments related to drug tests. Like
your topic was how can adverse childhood experiences, children with them, how can they be taken care of in child care institutions? So why don't you come to that topic?
जब हम बात कर रहे हैं कि किस तरह से समाज में हमारा क्या रोल रहेगा, हम पहले करते हैं एसएमसी की बात करते हैं, स्कूल मैनेजमेंट कमेटी, जिसके अंदर स्कूल्स के टीचर्स आ रहे हैं, प्रिंसिपल आ रहे हैं, मैनेजमेंट में भी आ रहे हैं, बच्चा भी इसमें इंक्लूड होता है और पेरेंट्स भी इंक्लूड होते हैं, ठीक है। तो ये कमेटी बनती है। इसके साथ हम कर सकते हैं माँ मंडल सोसाइटी में, क्योंकि मदर का रोल बहुत ज़्यादा होता है, मदर बहुत ज़्यादा इफ़ेक्ट करती है बच्चों को। माँ मंडल हम बना सकते हैं, 10 मदर के साथ में एक टीचर को हम एसोसिएट कर सकते हैं। इसके साथ जब हम एसएमसी की और बात कर रहे हैं तो हम इसमें लेकर आ रहे हैं RWA, रेसिडेंट वेलफेयर एसोसिएशन के जो लोग होते हैं हम उनको ला सकते हैं, हम एसएमसी के लोग, पुलिस डिपार्टमेंट के लोगों को ला रहे हैं, हॉस्पिटल के लोगों को ला रहे हैं, जो हम कनेक्ट कर सकते हैं।
We have assigned the responsibility to brainstorm over the resources and the support which are currently exist for the children who are experiencing adverse situation in their life. And we although this problem is quite big and the dimension, looking to the dimension, I think it requires a lot of further brainstorming, engagement of different stakeholders, starting from the local levels to country level. We have tried to collate our thoughts, and since this problem is a national level or we can say global level problem, so we think that from that point of view, state is the primary stakeholder who can actually play a big role. Coming from that point of view, we try to understand what are the existing human resources. Except their teaching thing, they have to also play a number of roles assigned by the state. So these units are also struggling from that point of view.
Availability of various national and state helplines which are also available in case if a child is facing any kind of abuse, so they can approach there. And also third is state mental health authority. Under the Mental Health Act, there is a provision to set up a state mental health authority. So it is already there. So structures, if you look at the legal structures, all the structures are available. There are many laws are available related to the children for their safety, for their protection, in terms of, and also for their health and everything. But the implementation of those acts and policies is a big challenge for us. That's also a barrier, because one which we can brainstorm about is there is very lack of intersectoral department coordination. That is one of the big issues we all are working in. To find out one special educator for a child so that I can take them to court so that the child can testify. I have to put application in multiple places and then beg to the special educators to please come, because they are also scared to go to a legal system, and that fear needs to get out. So if the panel is there, so the judges can also, the police can also, at the time of when they found a child, at the time of when they trace a child, so they can make use of those panel.
So as we saw in the presentation, the street children, they have, it seemed that they started using 1.5 years earlier than the children that have access to housing. That is actually because the peddlers and the drug selling is happening right in front of them. And as for children that have access to housing, they can still be monitored, and there is some timeline for them to get out of their houses. Media influence, that the drugs are made to be seen as cool, fun, and something that will give you a high place in society. And then bribery to the law. So the police officers, they are bribed, and again they take a cut out of what the peddlers sell. And then again, it doesn't stop any of the drug use. How to address these causes? Strengthening resilience and coping skills. Community mental health services, so we need more of these centers, more of services available. Outreach workers, peer educators who can go from district to district, household to household, help us.
Really thought through a lot of the complexity and the challenges.
So, and you didn't do it lightly, you actually did probe into some of the serious obstacles and some of the issues. So on that level, I will congratulate the 4 groups. I'm fairly confident that this has actually been a productive, small gathering of 6 hours, but we've actually got something positive and to move on to. And so I congratulate all of you, and I'm very grateful that people have been here, have debated, have been participating constructively. So I think this is where we're moving forward, is to actually, we've got something, we know what the issues are, not all of them, but we know that we've actually also developed some networks.
Thank you very much, Alok sir, for taking out time and coming. Thank you very much.
I must give a vote of thanks to the SPYM for planning and executing this outstanding workshop.
इन लोगों का विशेष धन्यवाद. Special thanks to Shwetank ji, Gary, Kalyani, Aditi and Priyanka.
Thank you, sir. Thank you very much.
Thank you.
Thank you.